Hey guys, Dr. Hampton here. Welcome to my channel. I am so happy to be here today with Dr. Koz, who's a functional medicine doc and author of his new book, Unfunc Your Gut, Boost Your Immune System, Heal Your Gut, and Unlock Your Mental, Emotional, and Spiritual Health. And, I really wanted to bring him along because many of us conventionally trained docs are not as familiar with something called SIBO, and that's small intestinal bacterial overgrowth. And the reality is, if the bacteria grows in the wrong place, it can cause all kinds of trouble. So just in case you're having problems with your belly, I want to make sure this is not the problem. So let's talk a little bit, Dr. Koz, about what that is and what people can do about it if they got it.
Yeah, absolutely. So as a functional medicine gut doctor, SIBO is the most common thing that I treat. I deal with more SIBO than anything else. From a basic level, all of us have what's called our microbiome, right? And our microbiome is 3 to 5 pounds of bacteria, viruses, parasites, yeast that live in our gut. But they should live in a specific place in our gut, and that's your large intestine. So when we talk about gut, it's made up of your mouth, esophagus, stomach, small intestine, large intestine. And it is a long tube, right? There's openings on both ends. And so each part of that tube has different functions. In general, the gut has three main functions: digestion, absorption, and then to me, the most important one is protection. The gut decides what comes into our body and what stays out. So for people that have heard that term leaky gut, that's what it is. But that kind of brings me to the significance of why SIBO is such a nasty problem to have. So the bacteria, when they're good, they're called probiotics, right? And the analogy I really like to think about your microbiome, this 3 to 5 pounds of bacteria in your large intestine, is it's like your own garden. And in that analogy, the probiotics are the plants, fibers and sugars are the fertilizer. What happens in a garden when you don't take care of it is weeds grow, or those weeds start growing in other places. And that's what SIBO is basically when the garden has moved into a place that it's outside of its boundaries. So the bacteria, when they're healthy, have lots of important roles in the large intestine. But sorry.
Did it break up?
Yeah, sorry. So the bacteria, when they're healthy in the large intestine, have many important roles. When they move into the small intestine, the main role in the small intestine should be digestion and absorption. So your small intestine is about 20 feet long. Your large intestine is like 3 to 5 feet long. But in those 20 feet of small intestine, before you hit the large intestine, food and acid pass from your stomach and into the small intestine. When they're in there, the pancreas releases enzymes that help you break down fats, carbs, and whatever proteins left over. Your liver makes bile. Bile is stored in your gallbladder. Bile goes into the small intestine and helps you break down fat. So we've broken down everything in the small intestine. That is where we absorb the nutrients. So your small intestine is lined with these things called microvilli. They kind of look like little finger outpouchings. So they estimate there's about 2,000 square feet of absorptive surface in the small intestine. So how do we turn 20 feet into 2,000? It's those microvilli. So that's how the small intestine should function. It should be this area where we're digesting and absorbing food. We're digesting food, absorbing nutrients. When bacteria move up into your small intestine, now that area that should be covered with these outpouchings is covered in bacteria. And one of the most important things to understand about your microbiome is that it's alive. And your bacteria need to eat to survive. They eat fibers and sugars. So somebody with SIBO, every time that they're eating, their gut bacteria are eating. And there's a very small barrier of entry into your body. So if they're eating and it's creating these toxins, it's creating inflammation, it's creating gas, and all of that gets into your bloodstream. And that can create a lot of problems. So I think another huge thing about SIBO is that over the years, I've met a lot of patients who actually don't even have gut symptoms. So I've worked with people with SIBO that all they have is like eczema or canker sores or fibromyalgia, but they don't have gut symptoms. And that might be because they're just not really connected to their gut and they think what they're feeling is normal. But it can trick you as a practitioner because you're like, why would I test this person for SIBO? They don't have the classic symptoms are your bloating, your abdominal pain, gas. It could be constipation. It could be diarrhea, like the classic IBS stuff. But there's a lot of people with these chronic systemic diseases that are actually, they originated from this bacterial overgrowth. Another huge problem with SIBO is that it doesn't matter if the bacteria are good or bad. So you could have probiotics overgrowing your small intestine, the good bacteria, but that's still not good. That's still a huge problem because the function of the small intestine is then lost. So that, and then when it comes treatment of SIBO, one of the more effective things, in my opinion, is a diet that starves the bacteria. That is called the low FODMAP diet. On top of that, so you're avoiding, it's like basically highly fermentable foods. You're avoiding those foods, and that way the bacteria, if they're not eating, they die. The other things that I do are either real antibiotics, so pharmaceutical antibiotics, or natural antibiotics, which is different kind of herbs that kill bacteria. There's a lot of herbs that we can use, different ones, different blends. And that's what depending on what somebody's test looks like, because also when you do testing, someone could either be hydrogen positive or methane positive, different gases that you blow out. So depending on what somebody's test looks like, we decide what treatment route to go with. The last thing I'd like to say about, if we've got a few more seconds, is about how to test for SIBO. It's kind of a cool strange test. It's tested through the breath, and it's called a 2-hour breath test. That's what a SIBO test is. So the most important thing to understand is the bacteria are alive. And so if they are exposed to sugars, they're going to eat them, which creates gas, right? So what a 2-hour breath test does is you drink a little shot of lactulose, which is a sugar, and then you blow into a balloon every 20 minutes for 2 hours. That lactulose in the first 2 hours goes from your mouth, esophagus, stomach, small intestine. It should not reach your large intestine. So you should not blow out any gas in those first 2 hours after drinking the lactulose. If you start blowing out gas, the sooner, the higher up the bacteria probably are. So there's a lot of doctors out there using 3-hour breath tests. I can't make sense of that because it's completely normal for between hours 2 and 3 to be positive because you're in the large intestine now. So you should be blowing out lots of gas.
Right.
But there's still people ordering that. So
that's right.
2-hour breath test is the way to go to diagnose it.
I definitely learned that in my nutrition and functional medicine training, what you just said about the 3-hour question. If a person is listening, most conventional medicine trained docs don't really do this type of testing. So I know you wrote about this in your book. So what's the next step for a person who is concerned, thinking maybe I got this? What should they do? I mean, is your book going to guide them? Should they look for a functional medicine doc? What would be a next logical step?
So my book will guide someone with starting to clean up the diet to start treating SIBO that way. But in order for it to be properly done, I wouldn't say that that's the full treatment, right? I'm a very objective person. I'm traditionally trained doctor. I like to run tests. And I highly recommend. I mean, there are GI doctors now that are ordering SIBO tests. A lot of times they have no idea what to do with it, but they are ordering them at least. So I would go, and if you can't find a regular GI, then or you prefer a functional medicine doctor, they can definitely order it for you. And I would get tested, because then based on the testing, it kind of determines what treatment route I would recommend. So I do think that you can. I've met actually a lot of patients that another interesting thing about SIBO is when you have gut symptoms and you tell like your average friend, like, hey, I'm having bloating, constipation. What do most people tell you? Go get a probiotic. What does a probiotic do? It makes more bacteria grow in your gut. So I've had, I mean, I've had so many patients. I've had patients crying in my office because they're like, "So you're telling me everything that I've been doing has been wrong, but you're doing the stuff that you think
Right.
is healthy, and it is healthy if you don't have SIBO." But so a lot of people can get better just by stopping their probiotic and getting on a low FODMAP diet. Um, but
All right.
typically, it
That's
requires more treatment,
okay.
which I would start with testing.
Okay. I do think data is important. So you won't chase your tail, and you're actually finding some actionable data to look at. So I appreciate that. I'm glad you kind of dove a little deeper. A lot of people have not heard of SIBO, and I hadn't heard of it until I started some additional training as well. So thank you, Dr. Koz, for your insights. And for anybody listening who really enjoyed what Dr. Koz had to say, you can check out podcast episode number 58. I'll have a link in the show notes where we'll dive even deeper into other aspects of functional medicine. And a lot of those aspects have a lot to do with how we protect our nests. So thank you again. And please like and subscribe to the video. And until we have another discussion, be safe, be well, and continue to protect your nest.